ನಮಸ್ಕಾರ, ನ್ಯೂಸ್ 26ಗೆ ಸ್ವಾಗತ. ರಾಷ್ಟ್ರೀಯ ದುಂಡು ಮೇಜಿನ ಸಭೆ ಆಯೋಜಿಸಿದ್ದ ಗ್ಲೋಬಲ್ ಹೆಲ್ತ್ ಅಕಾಡೆಮಿ ಸ್ನಾತಕೋತ್ತರ ವೈದ್ಯಕೀಯ ಆಕಾಂಕ್ಷಿಗಳನ್ನ ಬೆಂಬಲಿಸಲು ಎಐ ಸಕ್ರಿಯಗೊಳಿಸಿದ್ದ ಜಿಎಚ್ಎ ಸ್ಟೆಪ್ ನೀಟ್ ಪಿಜಿ ಅಪ್ಲಿಕೇಶನ್ ಅನ್ನ ಪ್ರಾರಂಭ ಮಾಡಲಾಗಿದೆ. ಭಾರತದಲ್ಲಿ ವೇಗವಾಗಿ ವಿಕಸನಗೊಳ್ಳುತ್ತಿರುವ ವೈದ್ಯಕೀಯ ಶಿಕ್ಷಣ ಪರಿಸರ ವ್ಯವಸ್ಥೆ ಮತ್ತು ಅದರ ಉದಯೋನ್ಮುಖ ಜಾಗತಿಕ ನಾಯಕತ್ವದ ಪಾತ್ರವನ್ನ ಚರ್ಚಿಸಲು ಪ್ರಮುಖ ಪಾಲುದಾರರನ್ನ ಒಟ್ಟುಗೂಡಿಸುವ ಸಲುವಾಗಿ ಭಾರತೀಯ ಆರೋಗ್ಯ ಶಿಕ್ಷಣ ಭವಿಷ್ಯಕ್ಕಾಗಿ ಸಿದ್ಧ ಜಗತ್ತಿಗೆ ಸಿದ್ಧ ಎಂಬ ವಿಷಯದ ಕುರಿತು ಗ್ಲೋಬಲ್ ಹೆಲ್ತ್ ಕೇರ್ ಅಕಾಡೆಮಿ ಮಹತ್ವದ ದುಂಡು ಮೇಜಿನ ಸಭೆಯನ್ನ ಆಯೋಜನೆ ಮಾಡಿತ್ತು.
Open the app and the first thing you notice is the countdown. Days to the exam above a rising tally of completed steps. Each step is a 4-beat micro lesson. It starts with a quick retest of past year questions to pinpoint your baseline, flows into a precision cut video that hits only high-yield concepts, follows with a post.
Looking at healthcare education and the way India is poised to look at healthcare education. In our thought process, we believe we can be the world's medical classroom. Having some of the best leading faculties with us, having best infrastructure today, we really look at this. Dr. Nagesh will remember about 10 years back, we looked at India as a healthcare destination. So we were welcoming patients from all over the world to come to India for treatments. And today, again, we meet for healthcare education. So I'm sure we believe that we have the required ingredients to make India, poised for the world. And this whole dialogue today is going to be beginning a small.
Maybe first few minutes I'll say a few things and ask panelists also to make initial remarks before we open up for his questions. One of the things, having graduated a long time ago from St. John 75, immigrated to US, one of the things I found out even at that time, how good our basic knowledge was. See, one of the main ideas as medical students, sometimes we don't recognize ourselves, is I think we are very well trained in India in basics. We are extraordinarily good in clinical acumen. We know how to make a diagnosis. So when I went to US, one of the things was when I started my practice after my training, one of the things they appreciated was how good you are as a clinician. Not as a researcher, not academic, but clinician. We were basically clinicians were very good. And with that knowledge, of course, there was like what Anita said, a lot of people go abroad seeking higher knowledge, higher things in terms of research, academics, postgraduate training, the technology. So it was rather common. But now when we come to 2025, it is important to understand where we are in this world of medicine.
As you rightly said, there needs to be certain innovations. I totally agree with you at the MBBS level itself, because most of us, we pass out, for example, if you take an oncology itself, most of us do study a part of malignancy as such in MBBS curriculum. But how many of us have really seen a radiation oncology machine or the procedures of chemotherapy being given? So as you rightly said, this is where we lack basically. One is we are not, I think as of now, we don't have a holistic approach as such in the Indian system. That's where we are lacking. And the other thing what I said is actually sensitizing these youngsters to the overall growth, like what we are, when we compare to the Western standards, when we compare our learning and their learning, there is a gap, because their way of teaching, their way of putting a clinical presentation or a clinical scenario is totally different. Yes, we diagnose, but we have our own method of methodology of diagnosis.
interestingly, the more you start talking about it, the curve here started increasing. It was 25, it went to 29. That's really stimulated the audience. There are many things and for us to discuss. Yeah, I will start the research work that you you have taken it first. I know that it's a very passionate about it. We as a clinician, undoubtedly, we are really good, and our first answer is on that. But as the days went by, years went by, and the technology also improved, and we started looking at it. Then we realized, yes, we really lack in a research and looking at what next can we do. And that is the way the research comes into picture. And that was virtually very negligible portion that we had in the beginning a few decades ago. But at least now, in every institution, it is increasing, but not to the proportion as expected. So if the number is going up, probably I feel it is in that region and we are really lacking.
Earlier it was MCI, now it is NMC. But I don't think there is any visible shift in the attitude of NMC towards the medical education. Because even to bring about a change in the syllabus, it takes a very long route. The universities should be given flexibility to have the rearranged whatever the syllabus, curriculum, apart from what is laid by the statutory bodies, so that we can attract the students. We can also get ideas from different countries, what is going on, and imbibe those things into our curriculum, the training. And this needs to be addressed by the university authorities and national
friends in the audience. I think we've discussed a lot of things in the panel discussion already, thanks to all the esteemed guests for shedding light on major aspects about digital learning. I think you've heard my introduction, but still, just to introduce once again, I am Vivek Joshi, now still a doctor. Final year medical student in Bangalore Medical College and Research Institute. I come from a very humble background, from a suburban area, Shira, where digital learning was a dream.
Good evening, thank you for being here. My name is Anita Niranjan and I'm the Managing Director of Global Healthcare Academy. This is an academy that has been looking at how we bridge skill gaps for all our clinicians, doctors and researchers. Having said that, we see that there is a lot of MBBS aspirants who are looking to get into NEET in the desired program that they want to do in specialty or super specialty. And the app that we have launched today is going to be extremely instrumental in helping them achieve what they want to do in whichever way they would like to do, as we know that students are already burdened with a lot of learning 19 subjects during their curriculum. So this app gives them the comfort from their homes. They can actually download the app and study from home and appear in all their exams very successfully. We have the app which will work from the year 1 itself, which will also help crash courses as well. So I'm sure students are going to much benefit. One of the uniqueness of the app is, of course, mentorship. We have very good people who have passed out with very good ranking who will mentor them, so they get to talk to them on a regular basis, which is going to help them get tips, get guidance and updates from these doctors. So this is about very proud moment for us for being launching GHA STEP NEET app.
And what is the objective behind this symposium?
This symposium is mainly, we know that about close to 78 countries look up to India for healthcare. We are sure that these 78 countries can also look up to India for healthcare education, because we are very proud of the kind of clinicians we have here in India, who are probably some of world-renowned clinicians, and learning from them is going to be extremely advantageous for students from these 78 countries as well, including India. India again is producing some very good skills, very good talent. So if we kind of look at it like that, we could probably be the next Houston, where healthcare education can contribute into the GDP of the state, the country, and as well as the city. Thank you.
ಇದಾಗಿತ್ತು ಟುಡೇ ಅಪ್ಡೇಟ್ಸ್. ಇನ್ನಷ್ಟು ಸುದ್ದಿಗಾಗಿ ನೋಡ್ತಾ ಇರಿ ನ್ಯೂಸ್ 26 ಕನ್ನಡ. ನಾವು ನಿಮ್ಮೊಂದಿಗೆ.